Hi, I'm Dr. Jamie Swale with Physical Therapy at Orthopedic and Spine Center, and today we're going to go over a few treatment options and exercises that we use for lateral knee pain. Okay, so one manual technique that we use is a release of the TFL muscle, and this is at the front of the hip. It feeds down into the IT band, which attaches on the outside of the knee. So sometimes if your knee is hurting, you can have some tightness in this muscle. Is it a little tender to the touch? And we can just do a myofascial or trigger point release in that muscle here. So a myofascial release is reducing the tension in that myofascial tissue between the skin and the muscles and other layers in there. So what we do is apply a pressure to what you can tolerate till we feel, feeling different directions, up, down, side to side, sometimes a little bit of a rotation. And we feel where that tissue is more restricted, and we just hold that pressure on there. So it can take 1 to 2 minutes. We can kind of tell when it starts stretching and relaxing underneath our palpation here. And again, also to tolerance of your tenderness or pain at the same time, and just working in and holding that tension in the tissue. Some massage therapists could use that technique as well, so you could have it done in other, settings and things like that, but typically we'll just do it as you're coming into the clinic for your treatment, and ideally that restriction will be reduced and you won't need it continuously. I'm going to also show you how to stretch it out on your own, so I'm going to take this out. If you bend your knees, okay, cross this leg over like you're sitting with your legs crossed in the chair all the way. And then you're going to rotate towards the opposite side. So she's stretching the front of that right hip and out to the side there at that TFL muscle. And just to where you feel a nice gentle tension and tightness, no sharp pain or anything like that. All right, and then come back to the middle. And you can do that about 10 times, hold it 5 to 10 seconds depending on when you start to feel that tension reduce. Okay? And then go ahead and sit up. We're going to go over a foam rolling technique for the IT band itself. That way you're balanced and have some support. And then you're going to roll down towards the knee and back up. And it's going to be a little tender, uncomfortable. But we like to do 1 to 2 minutes, and that'll reduce that restriction in there and take some pressure off the outside of the knee. Good. And you can focus in on any particular area of that IT band where it feels a little more tender or sore. Those are just a few options of what we might do for lateral knee pain.